Today, I'm here to explain everything you need to know about monkeypox and the current monkeypox vaccination. So hello everyone. Many people think that monkeypox has been circulating in our community for a long time because recent investigation reveals that there are two unique strains with different mutations. Fever, chills, and a rash that resembles little blisters on the temples are some of the frequent signs of monkeypox. It may manifest anywhere on the body, such as the hands, feet, lips, or face. Although transmission via respiratory droplets is possible but uncommon, monkeypox infection can also occur from exposure to infected animals, such as scratches or bites from rodents. Direct skin-to-skin contact with an infected and symptomatic person is currently the most common way for monkeypox to be transmitted. Or even consuming tainted meat. You should isolate yourself and get in touch with your local Department of Health for information on what to do and where you might be able to get treatment, because the majority of cases have not required hospital admission and there have been no known deaths in non-endemic locations. Despite the fact that monkeypox is not a sexually transmitted illness, gay and bisexual males are currently infected at higher rates than usual. Although it can spread through sexual and intimate contact, it's crucial to remember that anyone can contract monkeypox. There is currently no approved treatment for monkeypox because it is mainly supportive and the focus is on managing symptoms. However, there are antiviral medications. The average time from exposure to onset of symptoms is approximately 1 week, but it can be as early as 5 days and as late as 21 days. Which were created to cure smallpox and which have demonstrated some efficacy in the treatment of pox for high-risk groups. There are currently 2 vaccines available to protect against monkeypox, and historical evidence suggests that these vaccines are more than 85% effective in preventing disease in the general population. It is generally advised that those infected with monkeypox remain isolated until all of their symptoms and rash have completely resolved and healed. Although immunization is not officially advised, high-risk populations like sexually active gay and bisexual men are given shots in some jurisdictions like New York. The vaccination is generally well tolerated despite the higher infection risk in this community, but common side effects include fever and soreness at the injection site. It's crucial to discuss your options with your physician because some populations are more susceptible to vaccine side effects, such as those with immune system diseases, and it's typically not advised for individuals who are pregnant or intend to become pregnant within 4 weeks following immunization. Monkeypox belongs to the same virus family as smallpox. Some people might not even recall having smallpox. We have successfully eradicated the smallpox virus in humans. Because the viruses that cause monkeypox and smallpox are related, medications and vaccinations that have been approved for smallpox can also be used to treat monkeypox. In the United States, there are now 2 vaccines available to prevent monkeypox. ACOM 2000 is one of them, and administering it calls for particular training. May result in myocarditis or pericarditis, which are significant side effects that cause inflammation of the heart muscle. Additionally, it is ineffective for those who have eczema or HIV, among other skin disorders. Because it has been explicitly licensed by the Food and Drug Administration, health professionals generally believe that the Jynneos vaccination is a better option. A 2-dose vaccination protocol is that. The Jynneos vaccination is only extremely scarcely available in the United States. I'm observing that in places like New York and California, there's sort of conversation about doing the initial dose and delaying so we can get more people with the initial dose. If we had enough vaccine and could provide a bigger number of people at risk, we would do that. Does that ring a bell? Recall COVID? It is awful. It's not even a fatal disease, and this vaccination has been around for such a long time. It is more difficult to spread than COVID. However, the nationwide vaccination program is utterly terrible. By the middle of 2023, we should have up to 7 million doses thanks to orders placed by the federal government. Because there are only a limited number of Jynneos vaccine doses available at this time, state and local governments are putting restrictions on who is eligible. Since men who have sex with men make up the vast majority of cases, these restrictions are typically placed in the locations with the highest vaccination rates. This is especially true for men who have had sex with men recently with multiple partners. What about monkeypox treatment? We can take drugs like tecovirimat, a type of antiviral also referred to as T-pox. Actually, we're still investigating how well it functions. We are indeed dispersing it in accordance with an emergency usage access strategy, and it has been demonstrated to have activity against the monkeypox virus. Currently, T-pox is available in the United States, but it must be given under fairly strict guidelines because it hasn't been specifically licensed for use in patients with monkeypox. Doctors have been complaining about the difficult requirements they must meet in order to give their patients T-pox. However, the CDC is making efforts to relax some of these rules.